Hi, we're at ViVe and happy to represent Digital Health Inside Out channel. And today we have an amazing guest. Please tell us your name and what you do.
I'm Keith Camhi. I run the Techstars Healthcare Accelerator powered by Permanente Medicine in Washington, D.C. So we are a scout and early on-ramp for innovations that are trying to tap into the Kaiser Permanente network. And we'll work with companies at an early stage, pre-seed to seed stage, and give 10 companies a year a $220,000 equity investment, plus the opportunity for 3 months to get mentored by and seek partnership with Permanente Medicine.
That's amazing. I know Techstars have a lot of healthcare programs.
Yeah.
I feel like at least I know 4, but there are probably more than that. How is your program different from others?
So, and we have a bunch of great healthcare programs. The ones that are fully healthcare focused, we have Baltimore that's funded as an investment vehicle and also partnered with Johns Hopkins and Care First and others. And then in Chicago, we have Northwestern. So the 3 of ours, Permanente Medicine in DC, Chicago, Baltimore, are all healthcare, and then other programs like Ohio State and USC have partial healthcare focuses. So
Fort Worth as well.
Fort Worth was a 3-year contract that ended. So that one's not running anymore. But yeah, terrific. We have a bunch of their mentors involved. And each are a little bit different. For our program in particular, we're focused on things that are seeking to get pilots with a provider network. And so we're hyper-focused on getting companies to pilot. And part of the application process is getting interviewed by physicians in your specialty area. And by the time you're getting into the program, you already have physicians who want to work with you as a founder with the objective of getting it integrated into their care model.
Tell us a bit more about the selection process. Well, what are your main criteria?
Yeah, so it's kind of the combination of the Techstars criteria and then the Permanente Medicine criteria. Techstars, for any of our programs, it's a team. So we say there are 6 criteria. The first 3 are team. So we're looking for founders who can get it done. That looks like, in the healthcare setting, someone who understands how to build something, someone who understands how to sell it, some kind of understanding of the regulatory pathways that you might face, all of the above. So a founding team that looks like you can drive through walls and is very motivated to solve the problem that they're working on. And then in addition to team, we're looking for a big market. So something, if you solve it, it'll be large. Some evidence of traction that the customer wants what you're building, and an idea that kind of makes sense. And so that's kind of the collection of things we look for. And then on Permanente's piece starts focusing on the idea more, and they start looking at, is this a problem that we need to solve? And then is this something that they would want to actually work with if it got into the program? So it's beneficial to both the startup and to us to have that already decided on the way in. Yes, if you got in, there are physicians who want to work with you and they're interested in trying to get it to work within the practice. So yes, it's pretty powerful that way.
Super interesting, and I'd love to hear your opinion. I hear right now there's a big trend that solo entrepreneurs is getting more and more traction because, well, I feel like 5-7 years ago, accelerators were looking at startups with just one founder, and that was sort of a red flag, but now it's more like a common thing. What do you think?
So to me, it's interesting. So I think that it's key that the founder needs to be surrounded by other people that can support. Whether that comes in the form of co-founders or a support cast or whatever it might be is kind of fine from my personal perspective, and I've seen both be effective. I think it's really hard, though, to go it your own and do all the things that you need to do to make a startup succeed. So that's why the diversification of risk by having a team of people who are working together well is helpful. But I've had solo founders succeed, but never just single individuals as the only person. They might have a support cast that's equity motivated, but just not at a level of a co-founder.
I know Nick in Baltimore is focused on AI, healthcare mostly. What about your program? What's the percentage of startups are AI focused?
A lot of it's AI, but it can be more AI-enabled services. Some is pure AI. So like in our first program, we had pure AI, like digital twin technology focused on diabetes and cardiac care, and agentic AI outbound calls and inbound, so pre-op and post-discharge phone calls, that sort of. So some pure AI, but then also things that were not AI, so LGBT mental health care and specialty clinics for that, advanced care at home where nurses are actually going into the home and providing hospital level care, but in the home setting and saving a lot of costs. So we'll do a mix. Our lens is very much, again, if it works on the provider side and it works with the physician, it's helpful. AI is going to be just so much, whether it's part of the solution or how you're running the company, AI should be a key element of how anyone's doing business now. Nick's lens for Baltimore is very much it's going to be an AI-centric solution, but it could be go-to-market, it could be direct-to-consumer. So anything, and so the intersection would be AI for provider. You could kind of do either one. If you're eligible to get a pilot with Kaiser, I would suggest that ours is going to be possibly a leg up, an opportunity for you because you get the best of both worlds, I should say. Yeah.
Do you know the percentage of startups that fail right after the pilot with Kaiser?
Oh, after a pilot? Oh, no idea. We haven't had any, I should say that, but ours isn't. So I think, historically, and this is worth mentioning, so historically, and we've had mentors from Kaiser Permanente and other ones in my programs before I was working directly with Permanente Medicine. It's hard, until you're kind of a Series V company, it's hard to work with an organization that's that big. So we had mentors would tell us, hey, you don't want our companies, you don't want your companies here yet, because if they succeed, we will break them, because we're so big that if success is too big for them to swallow. The difference is by working with Mid-Atlantic Permanente Medical Group, which is a smaller group within Kaiser. There are 1,800 physicians, 800,000 covered lives, and very innovative, leading quality scores. They're the right size to be able to work with earlier stage companies and get a pilot going. Get, like, the executive medical director rolls up his sleeves to work with these companies and mentors them. And so you get real attention from them and the opportunity to go to market at a smaller scale, and then you prove it there, whether you're rolling out to the rest of Kaiser Permanente or externally other providers. You've got quite a leg up.
Super interesting.
Yeah.
Any takeaways from ViVe? Is this your first ViVe?
This is my first ViVe. Yeah.
Well, what do you think?
It's good to meet. It's good to have a convening where you meet people. I mean, the themes obviously that you hear in the workshops, you can hear, but you can see by reading the trends or the trends that are out there. There's AI. There's I should say that. The trends that we're hearing mirror the trends that we're focused on in the program. So we're going to be specifically focusing on tools that help restore trust in medical care, whether that's between patient and physician, or patient and AI, or physician to physician, things that remove friction, which are all the themes that are out there, things that reduce administrative burden, and then also women's health, aging, and chronic care. And so the themes are what you're seeing everywhere in the reports. So the sessions are one thing, but the opportunity to get together with a lot of people who are all focused on the same thing is great.
100%.
Yeah.
Well, tell our viewers, when is the next cohort, when is the deadline, so they know how they apply.
Good timing. So next week, the applications will open. So beginning of March, applications open, and we'll be doing a series of panel discussions and AMAs. So we're gonna have the executive medical director will do an AMA with us in a few weeks. So if you just follow our LinkedIn page, if you just Google Techstars Permanente, you'll find us. But you'll be able to come to an AMA and hear what they're doing there, and then a series of panels with different experts at Permanente over the next few weeks. Applications will be due end of May. So you got a couple months to look through and do it, and then selection will be for our September class.
Awesome. Well, I encourage everyone to apply it. And thank you so much, Keith.
Thanks for having me. Great to see you.